Primary signs of urinary disorders include changes in volume and appearance. Polyuria means too much urination, and this can be from hormonal or metabolic problems, maybe diabetes, maybe glomerulonephritis. Oliguria is reduced urine. Anuria is severely reduced urine, and both of these indicate serious kidney problems. A change in frequency could be an increased urgency or frequency, which might be from irritation of the lining of the ureters or bladder. Incontinence is the inability to control urination voluntarily. It may involve periodic involuntary leakage, stress incontinence, like when you're laughing or running or jumping, or the inability to delay urination, an urge, or a continual trickle of urine from a full bladder, which is overflow incontinence. Urinary retention with initially a person has normal renal function, and then urination just does not occur. And in males, this commonly results from an enlarged prostate gland. This would be older males, and it would be called benign prostatic hypertrophy, or and what this does is it results in compression of that prostatic urethra. Pain in the superior pubic region is associated with urinary bladder disorders. Pain in the superior lumbar region or in the flank that radiates to the left or right upper quadrants is associated with kidney infections, pyelonephritis, or with kidney stones, renal calculi. Dysuria is painful or difficult urination, which can occur with cystitis or urethritis. This would be inflammation of the bladder or inflammation of the urethra, or urinary obstructions such as an enlarged prostate in males. Edema or swelling occurs when renal disorders lead to proteinuria, which would be protein in the urine. You would see facial swelling, especially around the eyes. Fever would be when there is an infection. Cystitis is a bladder infection, which may result in a low-grade fever, and pyelonephritis, a kidney infection, can produce very high fevers.